Why is finishing so challenging? Why does it always feel like something is missing in those final steps of our cases? Is there a better, a faster, and a more efficient way to achieve the stunning results we all aim for? These questions were the ones that inspired me to explore my favorite orthodontic topic and write my Angle Society thesis, Finishing in Orthodontics, Literature Review, and a Historical Perspective. As I delved into countless articles, the definition that stood out as the most comprehensive came from McLaughlin and Bennett over 20 years ago. They emphasize the importance of facial and oral aesthetics, periodontal support, functionality, muscular dynamics, central correlation, and of course, the 6 keys of normal occlusion. As I mentioned, my desire to better understand the challenging step in orthodontics is not only personal, it's also the focus of my journey to become a member of the Northern California Angle Society. And to tackle this vast topic, I identified fundamental recurring points that I called key elements. These were instrumental in analyzing and comparing all the selected articles. But what is a key element? A key element is a specific orthodontic finishing concept mentioned at least once per article and at least in 3 out of the 28 articles that were selected. I said that 11% was the minimum threshold to determine what a key element was. I was able to identify 16 key elements, and we're going to see them together. I decided to structure my literature review in 2 steps. Step 1, the key elements collection. Step 2, the 5 different analyses that were fundamental to understand how the concept of orthodontic finishing evolved over the past 5 decades. Step 1, key elements. As you can see, we have the importance of tooth-side discrepancy, having finishing checklist, wire bending, tooth recontouring, proper bracket placement, periodontal considerations, repositioning assessment, importance of IPR overcorrection, specific malocclusions that require specific teeth position, importance of COCR, performing gingivectomy, TMJ assessment, the use of tooth positioner, importance of level marginal ridges, and final tooth whitenings. These 16 concepts called key elements were at least mentioned in 3 different articles. What were the inclusion criteria to select those articles? So I decided that the keywords needed to be in that were orthodontic finishing and orthodontic detailings needed to be in the title, abstract, or in the keywords of every single articles. They needed to report a qualitative or quantitative assessment of factors involved somehow in finishing in orthodontics. I selected only published articles in English. I searched using Cochrane Library, Google Scholar, Medline, and I was able to find articles only from 1971 until I ended my research in December 2023. Other inclusion criteria were that I did not exclude any kind of orthodontic technique, did not exclude any patient of any age, sex, ethnicity, any kind of malocclusion. I did not exclude any kind of craniofacial syndromes or abnormalities of cleft palate patients, but they were not found when I was looking for articles mentioning treating about finishing in orthodontics. Long publications consisting of 2 parts were considered as 2 separate articles because despite sharing a common topic, each paper addressed different aspects of orthodontic finishing. The exclusion criteria were, for example, publications that lacked peer review protocols, publications that were incomplete, duplicated were also excluded.